On behalf of the entire leadership team of the University of Maryland Medical System, I want to start by again saying thank you. I want to express our profound gratitude for the unbelievable passion and commitment that all of you demonstrate as we, as the University of Maryland Medical System, are indeed the home of the brave. Thank you for everything that you have done to keep our communities healthy and safe. And we want you to know that as a health system, your safety is our top priority. We have put in place many policies to ensure your health and to protect the workforce. An example of a new policy and process that is now going to be put forward is the fact that we will be doing temperature check screening on everyone who enters any of our healthcare facilities across the system. If you are an employee of the system and you are found to have a temperature of 100 degrees or greater, you will be referred to employee health and you'll be asked to go home, making sure that you have all of the connections necessary to ensure that you are safe at home. We've also implemented a new call center for our employees. The call center is designed to be able to answer any questions that our workforce has about their health and/or safety. I want to take the opportunity to once again remind all of us who are used to our behaviors that have defined our approach to healthcare delivery that if you are sick, you need to stay home. Please contact your managers, your directors, to understand what you should do in a circumstance where you do not feel well. I also want to give everybody an update of what we are experiencing across our health system, because I believe that what we are seeing in our health system is consistent with what we are seeing across the state of Maryland. We are thankful that it would appear that we are now in a period of plateau when it comes to the number of new cases that we are seeing across our health system. Now, we watch this data every day because we want to ensure that as we plateau, the next step in our recovery is a period of decrease in the number of cases. That we are not there yet. But the fact that we are now at a plateau allows us the opportunity to start being purposeful in defining our recovery phase. And part of that recovery phase is having purposeful conversations about how we will return elective healthcare safely to our medical care institutions. And when I describe safety, I mean safety to our community and safety to our workforce. I also want to speak for a moment about the financial standing of the medical system. It is a question that I've been asked often in the last few weeks, and I want to again clearly state that we, the medical system, are in strong financial positioning. And I know this is a concern across many of the conversations that I've had in the last few weeks. But again, we as a health system, from the earliest onset of our planning around our response to this crisis, made a very purposeful decision to invest in our workforce. And the policies and the process that we've put in place, I am hopeful, is demonstrating that commitment. And we are not wavering from that commitment to our workforce. As a show of support, I'm very proud to announce that the CEOs across our health system have made a personal decision to contribute a percentage of our salaries from this point forward through the rest of the fiscal year to the Employee Emergency Assistance Fund. And these funds are being set up or exist to allow our workforce who are experiencing personal financial hardships to apply for unique resources to help relieve some of the personal burden that they may be experiencing. So again, on behalf of our entire leadership team at the medical system, thank you for what you do. Thank you for your commitment. And I am confident that collectively, we as a health system will come out of the backside of this healthcare crisis stronger as an organization and stronger as a health system. Thank you.